Have you ever been jolted awake in the middle of the night by a sudden, sharp pain in your leg or foot? You may think it's just a regular cramp, something that happens occasionally. But what if that cramp is your body's way of signaling something more serious, like a circulation issue? It could be more than just a minor inconvenience, it could be a warning sign of an underlying health problem. Welcome to Health Advice for You, your trusted source for understanding your body's hidden messages. Here, we help you decode those signals, providing tips and advice to lead a healthier, more active life. Don't ignore the warning signs your body gives you. Understanding them is the first step toward living a longer, healthier life. Tune in as we dive into what these cramps really mean and how to take proactive steps to protect your health. Let's break it down. A muscle cramp is a sudden, involuntary contraction of one or more muscles, often occurring without warning. These cramps can last anywhere from a few seconds to several minutes, and while they are usually harmless, frequent or intense cramps may signal a more serious underlying issue. Cramps often happen after dehydration, excessive physical activity, or mineral imbalances like low potassium or magnesium levels. However, if cramps become a recurring problem, especially during rest or sleep, it's important to pay closer attention. This could indicate a deeper health concern, such as poor circulation or nerve-related issues, which requires medical attention. Don't ignore these signs, as they may be your body's way of alerting you to something more serious. Most people dismiss cramps as nothing more than a side effect of exercise, stress, or even dehydration. However, frequent cramps, particularly those that occur at night, can be an early warning sign of a more serious health condition such as poor blood circulation. Leg cramps, especially those that affect the calves or feet, can sometimes point to peripheral artery disease (PAD), a condition where the arteries in your legs narrow and reduce blood flow to the muscles. PAD restricts the amount of oxygen and nutrients reaching your limbs, which can lead to cramps, pain, and even more serious complications if left untreated. Did you know that over 200 million people worldwide suffer from PAD, many of whom are unaware of their condition? It's crucial not to ignore recurring cramps, especially at night, as they may be a sign of this serious vascular issue that needs attention. Your circulatory system functions like a highway, carrying oxygen and essential nutrients to every cell in your body. When the flow is smooth, everything works as it should. However, when blockages occur due to cholesterol buildup, blood clots, or plaque, it's like a traffic jam on that highway, slowing down circulation and leading to problems. When tissues in your muscles don't receive enough oxygen due to restricted blood flow, they enter survival mode. The result? Pain. This pain, often felt as cramps, can strike during physical activity when muscles need more oxygen, or at night when blood flow naturally decreases. If your body isn't getting the oxygen it needs, it sends a distress signal in the form of cramps, which may indicate an underlying circulation issue. Don't ignore this warning, your body may be trying to tell you that something is wrong. Here are some warning signs that your cramps might be linked to circulation problems. 1. Cramps while walking or climbing stairs. If you experience cramps or discomfort in your legs during physical activity, such as walking or climbing stairs, it could indicate reduced blood flow to the muscles. This might be a sign of peripheral artery disease (PAD) or other circulatory issues. 2. Cold or pale feet. Healthy circulation helps maintain body temperature. If you notice that your feet are unusually cold or pale, it could be a sign that your blood is not flowing properly to your extremities, suggesting circulation issues. 3. Leg hair loss or slow nail growth. Proper blood circulation delivers essential nutrients to your skin and hair follicles. If you start noticing thinning or hair loss on your legs, or if your nails grow slowly or are brittle, these could be signs of poor circulation. 4. Sores that heal slowly or don't heal at all. When blood flow is restricted, wounds and sores, especially on the legs and feet, may take longer to heal or not heal properly. This could indicate that your body is not receiving the nutrients and oxygen it needs to repair itself. 5. Weak pulse in legs or feet. A weak or absent pulse in the legs or feet is a concerning sign that blood flow is impaired. If you can't feel a strong pulse in these areas, it's a sign that your circulatory system isn't functioning as it should. If you're experiencing any of these symptoms, don't wait. It's important to talk to your doctor and get evaluated. Circulatory problems like PAD can worsen over time, leading to serious complications such as stroke or limb loss. Early detection and treatment can help prevent these outcomes and improve your overall health. Let's explore the solutions. There are certain habits that can significantly impair your blood flow, leading to a variety of health issues over time. One of the most harmful is smoking, which damages blood vessels, reduces oxygen supply to tissues, and promotes plaque buildup in arteries. Another key risk factor is a sedentary lifestyle. Sitting for long periods without moving restricts blood flow, especially to your legs, increasing your risk of developing poor circulation and related conditions like deep vein thrombosis, DVT. An unhealthy diet also plays a major role in circulatory problems. Diets high in processed foods, saturated fats, and sugars can lead to high cholesterol levels, clogged arteries, and increased inflammation. Obesity is another significant risk factor. Carrying excess weight puts additional strain on your heart and blood vessels, reducing circulation and increasing the likelihood of cardiovascular diseases. Finally, poor sleep can negatively impact your circulation by affecting your heart rate and blood pressure regulation. Chronic sleep deprivation is linked to a higher risk of developing circulatory problems. The good news is, you can make small, impactful changes today to improve your circulation dramatically. Start by quitting smoking, staying active with regular exercise, eating a balanced diet rich in fruits, vegetables, and healthy fats, maintaining a healthy weight, and prioritizing good sleep habits. These changes don't have to be overwhelming. Even simple steps like walking more and drinking plenty of water can go a long way in boosting your circulation and protecting your long-term health. When you visit your healthcare provider to discuss your symptoms, they may recommend several diagnostic tests to determine if circulation issues are contributing to your cramps or other concerns. One of the primary tests is the ankle brachial index, ABI, which compares the blood pressure in your ankle to the blood pressure in your arm. This test helps assess how well blood is flowing to your limbs, particularly your legs and feet. Another common test is the Doppler ultrasound, which uses sound waves to create an image of blood flow through your arteries and veins. This test can reveal blockages, clots, or narrowing in your blood vessels, providing a clear picture of your circulation. Your doctor may also check blood pressure in your limbs to identify any discrepancies that could signal poor blood flow. Monitoring blood pressure at various points can help detect issues with arterial health that affect circulation. In addition, cholesterol and glucose blood tests are crucial in assessing your risk for circulatory problems. High cholesterol levels can contribute to plaque buildup in the arteries, while elevated glucose levels may indicate diabetes, a condition that can damage blood vessels and impair circulation. These tests help us determine if restricted blood flow is behind your symptoms. Your doctor may explain. Early detection of circulation issues through these tests can help prevent serious complications, including stroke, heart attack, or even limb loss. Identifying and treating the underlying problem early can significantly improve your prognosis and prevent long-term damage. As we age, our blood vessels naturally lose flexibility, which can affect blood flow throughout the body. This is why individuals over the age of 50, particularly those with conditions like diabetes or heart problems, should never ignore recurring cramps. Cramps may seem like just an inevitable part of aging, but they could be a sign of something more serious, such as poor circulation or cardiovascular issues. "I used to think cramps were just part of getting old," says one patient. "I never imagined they could be connected to my heart health." This is a common misconception. While aging does contribute to some changes in the body, persistent cramps, especially in the legs, should always be evaluated, as they may indicate underlying issues that need attention. If you're over 50 or have any health concerns, it's crucial to seek medical advice if cramps become a frequent problem. Early detection can help manage and even prevent serious complications related to heart health or circulation. Let's take a look at some real stories from people in our community who have experienced how cramps can signal more serious health issues. One runner in his 30s shared how frequent leg cramps led him to discover early-stage varicose vein disease. He initially thought the cramps were just a result of his intense workouts. But after consulting a doctor, he found that poor circulation was the real cause. A mother of two, who had been ignoring nightly cramps for months, eventually learned that she had deep vein thrombosis, DVT. Her doctor explained that the constant cramps were a sign of a blood clot, which could have been life-threatening if left untreated. An elderly man, struggling with regular leg cramps, found relief after making dietary changes, specifically switching to a Mediterranean diet. His cramps significantly reduced, and he regained much of his mobility after improving his circulation through healthier food choices. These stories highlight how cramps can be more than just a minor inconvenience. They can be early warning signs of circulatory problems that require attention. Always listen to your body and seek medical advice if you experience persistent symptoms. Don't wait until a cramp becomes a serious health issue. Take control of your health with proactive prevention. Simple lifestyle changes can make a big difference in maintaining good circulation and overall well-being. Start by stretching before bed to relax your muscles and improve blood flow. Elevating your legs at night helps blood circulate more easily, reducing the likelihood of cramps. Staying active throughout the day, even with light exercises like walking, can significantly boost your circulation. Incorporate blood-healthy foods into your diet, such as leafy greens, fish rich in omega-3s, and foods high in antioxidants. It's also important to avoid smoking, which can harm your blood vessels and reduce circulation. Finally, make sure to check your circulation regularly with your doctor. Early detection of any issues can prevent more serious complications. Remember, your body speaks. Are you listening? Taking these small steps today can help you avoid bigger problems tomorrow. Today, you've learned that muscle cramps aren't always harmless or just a minor inconvenience. In some cases, they could be subtle signals from your body, particularly your arteries, indicating that something isn't quite right with your circulation. While occasional cramps may be due to common factors like dehydration or muscle fatigue, frequent or severe cramps, especially those that happen at rest or during the night, can be early warning signs of more serious conditions like poor circulation or peripheral artery disease (PAD). It's crucial not to dismiss these symptoms, as ignoring them could lead to long-term complications. Prevention begins with awareness of these potential warning signs, and the action to protect your health starts with you. By paying attention to your body's signals and seeking medical advice when needed, you're taking the first step towards safeguarding your health. If this video has helped you understand the importance of recognizing and addressing these signs early, please hit the like button, share it with a friend. And don't forget to subscribe to our channel for more science-backed health advice every week. We'd love to hear from you. Comment below. Do you get leg cramps at night? Let's start a conversation and learn from each other's experiences.